Memory extinction is the process of learning that a previously paired stimuli does not associate with a negative response. This process requires cueing the association memory either through exposure of the stimuli or remembering of the memory. Following this is a lack of a feared response. Quirk 2014 showed that rats can learn an unpairing of a learned feared response by pairing the stimuli with an unharmful response. As a variety of phobias hinge on intense fearful responses to typically unharmful stimuli, this type of training proves extremely useful to reduce stress and anxiety in these patients. PTSD patients have been a great focus in extinction training, particularly through the use of VR, as patients of these phobia have memories of extreme stimuli exposure which cannot easily be replicated. VR allows for replication of the memory in a controlled environment, thus allowing patients to learn the non-fearful response. VR treatment for PTSD would initially require the patient to recall his or her memories that most vividly evoked fear. A virtual reality world similar in setting would be created. This would include location, sounds, number of people, or any other aspect that most elicits the fear. Therapy would focus on tackling each aspect of the VR world to no longer be associated with fear. Eventually, this leads to the entire fear-evoking setting to no longer elicit fear. Sounds of fearful memory would be played following a non-aversive response until the sounds no longer elicit fear. This type of recall of memory with no negative response would be repeated for all other aspects. Finally, a collection of all these senses will be presented to the patient until fear is no longer expressed. This differs from typical exposure therapy as it does not account for the feared response of the patient, but rather on making sure that the memory of the fear association no longer elicits fear. This typically means that training must be done in one setting and often with many cued recall experiences. This can be extremely difficult and intense for the patients. However, this may help patients who quickly wish to tackle their phobias. Furthermore, the piece-by-piece recall aspect covers a variety of real-world potential stimuli that may initially trigger fearful responses. Although it proves extremely difficult to tackle each individual aspect of the memory that evokes fear, this treatment serves more to separate real-world stimuli to remain neutral and for the feared memory to remain as a fearful response in the past.